Work can be stressful for anyone, but imagine being subjected to workplace aggression daily. Workplace violence in healthcare puts staff and patients in dangerous situations, especially those working in the emergency and psychiatric departments. Workplace violence is defined as non-fatal violence against an employed person or persons occurring while at work or on duty. 45% of all workplace violence incidents occur in the healthcare setting. According to OSHA, incidents of serious workplace violence are 4 times more common in healthcare than in the private industry. Gerard Gastro, Project Director for Patient Safety Initiatives at the Joint Commission, states, "If you think about it from the perspective of a nurse that deals with patients on a day-to-day basis, it's like, how often have they been called names or hit or spat on? And that would fall within the definition of workplace violence. Surveys and reports suggest that many incidents of workplace violence such as these go unreported in the healthcare industry. Provided that patient-perpetrated violence is the main cause of workplace aggression in healthcare, emergency department staff and psychiatric staff are more likely to face workplace violence." According to Marilyn Reidnor, Division of Safety Research, nearly half of emergency physicians reported physical abuse, 20% of psychiatric nurses were physically assaulted, 43% were threatened with physical assault, and 55% were verbally assaulted at least once during a single work week. The growing opioid epidemic is a factor in growing workplace violence in healthcare, according to the briefings on hospital safety. Michigan emergency physicians reported at least half of all assaults are committed by people who are seeking drugs or under the influence of alcohol. As a result, workplace violence in healthcare affects patient care and staff health. An increasing number of medical staff reported feeling constantly fearful of becoming victims of assault. Workplace violence against medical staff distracts staff from focusing on patients needing urgent medical attention. According to Vidor Friedman, MD, violence in emergency departments is not only affecting medical staff, it is affecting patients. The briefings on hospital safety reports that 8 in 10 physicians say violent incidents affect patient care. Now that we know workplace violence in healthcare affects not only medical staff, but all patients waiting to receive medical attention, workplace violence in healthcare is a rapidly growing epidemic. It needs to be addressed as it is dangerous for all medical personnel and patients. Thank you.